There's no sparkles.
Divided into 4 zones. The femoral triangle, greater trochanter, sciatic nerve, iliac crest, and primary muscles of the hip group. There are some things, as Travis pointed out to me, that you may disagree with in this book. Travis and I both disagree. On page 153, figure 25, he's got them labeled wrong. And there's some other things that are wrong. It's saying that the adductor longus is the medial most muscle on the medial thigh. No, the gracilis is, etc. But we love Mr. Hoppenfield anyway and value his information. So with your expertise, just critique that for yourselves.
Wait, what figure is wrong on 153?
153. Let me turn back to it again. Where it's saying abductors, it ought to be adductors, would be medial.
Oh, it says adductors on both sides. Yeah. On the image there, it's got.
Yeah.
Okay.
And there's some other things you'll find in here.
So just that A44 to A24?
I'll have you look at it. I don't remember exactly. So just sort them out. Look at them and see what's not right. You're capable. First zone, I want you to palpate these on yourselves, and then we'll divide up into groups. We will open up another plinth so you can do it. We'll have to go head and toe here a little bit. Maybe we can use some floor. Femoral triangle. It is bordered by superiorly the inguinal ligament, or the abdominal crease, inguinal crease. From the ASIS down to the pubic tubercle makes the superior border. Medial border is the adductor longus, which we will identify later, and the lateral border is the sartorius, longest muscle in the body, etc. Within the femoral triangle, or locate the middle of the inguinal ligament and drop off just inferior into the soft tissue. There, splitting the middle of it is the femoral artery. It's quite superficial. You should be able to find a pulse there. Lateral to that is the femoral nerve. Medial to that is the femoral vein. The nerve and the vein are not typically possible to palpate. The vein is the one that we access the venous system down in the lower extremity. Deep to those structures, actually more medial along the inguinal ligament, are lymph nodes that you don't necessarily palpate unless they are enlarged or there's an infection in the body. Then you'll notice the little peanuts or peas, but otherwise you don't feel them. Deep to those structures, the floor of the femoral triangle is the pectineus, the adductor longus, and the iliopsoas. Quite deep, hard to palpate, but you can if you can get the person to relax enough. But Hoppenfield refers to them not being palpable. The iliopsoas, of course, the psoas major are your primary hip flexors. Deep to the iliopsoas is the iliopsoas bursa. And they may complain of pain with hip flexion because it compresses the bursa, but you can't palpate it. It's deep between some major muscles. And you cannot palpate the anterior aspect of the acetopofemoral joint because it's got so many soft tissues in there. Questions about the femoral triangle? Who's going to be my victim? Who's dressed appropriately for this today? May I borrow you? Actually, she's got tighter trousers on, but she's running the camera. May I borrow Kim? Would you please lay here with your head at that end facing me on your side?
Thanks, guys.
Hey, they're called trousers. We call them pants in Scotland.
Scotland?
That's a completely different thing.
Where'd you get your trousers? Where?
Did I say trousers? That's a good issue. It took me a long time to stop saying pants in England. Pants are your underwear. And it took me a long time to stop saying that, and I haven't gotten out of that habit. Okay, zone number 2 is the greater trochanter. You have learned how to find the greater trochanter. May I touch your body on the pelvic region? If there's anything I'm doing that begins to be uncomfortable to you, you have all the power. Just inform me and stop me. long before you get to the slap part. Okay, and we're going to put this on Facebook.
We'll go straight to the slap
Straighten
bar.
this leg out,
We'll do
please,
that.
and put this ankle right here. Okay, from the greater trochanter, from the iliac crest, you're going to drop straight down to the greater trochanter. I can find hers. Again, if you have a hard time, go behind where you think it is. It's usually the most prominent area on the lateral hip, especially on a woman. Go behind it and pull forward, and you'll get on it. If you still can't find it, then put the leg in line and internally relax a little bit, please. Internally and externally rotate. There, it's rolling underneath my fingers. In the trochanteric zone, you've got the greater trochanter. Just posterior to it is the bursa, trochanteric bursa, which you do not truly feel unless it's irritated, and then it feels boggy or spongy. Sometimes a person may land on the greater trochanter, so the bursa becomes irritated and enlarged. If the leg is flexed and internally rotated, the iliotibial band may snap over the greater trochanter, and that tissue may also become irritated. A person will complain of a snapping hip when they're doing an exaggerated hip flexion and knee flexion going into extension, like climbing a trail or running up a hill or something like that. Coming in to the superior end of the greater trochanter is the insertion of the gluteus medius and minimus, pure abductors. You can track them all the way up into the iliac crest in this region, just looking to elicit pain.
Abductors A24?
Pardon?
Abductors A24?
Correct. Gluteus medius and maximus. Medius and minimus. Okay, end of the femoral or greater trochanteric region. Next, from the greater trochanter, locate it with your thumb and go back to the gluteal fold and pull towards yourself, and you're on the ischial tuberosity. Splitting the difference between the two is the sciatic nerve. If you push in there, you may get an ache that will radiate, just hurt right there or on down the leg. That is the sciatic nerve zone, third soft tissue zone. It does pass through, as you recall the anatomy, through the piriformis muscle. If you do have pain in this area, it may be for one of three reasons. One is a herniated disc in the lumbar region. Two is the piriformis muscle is clamping down on it. And based on my experience, that's more often than not the reason. Piriformis spasm. And there's some stretches we can teach you later on to target that muscle to get it to calm down. Quite effective on the sciatic nerve. Or finally, a direct blow to the sciatic nerve itself is the third reason why you might have pathology. Again, greater trochanter, reach and pull into the greater ischial tuberosity. Thank you. There, I'm on it. Split the difference between the two is the sciatic nerve. Zone number 4 is.
Sorry, can you go over the reasons that you might have a.
Yes, and they are listed in the book.
Oh.
Herniated disc in the lumbar region, spasm of the piriformis, clamping down on it, or direct blow.
Oh, okay.
What page are you on there, Brad?
151.
Bottom right paragraph of 151.
Right below where it says figures 20 and 22.
Right.
Thank you. Okay, iliac crest region. Not a lot going on here because the iliac crest is actually quite superficial. But it runs from the ASIS back to the PSIS, and back on the posterior third, you actually have 3 nerves, the cluneal nerves. I have personally never been able to locate that and say, okay, that's the cluneal nerve. Hoppenfield says they're palpable. I've tried many times on very, very, very lean people, 5% body fat cross-country runners. Never been able to find it. But 3 nerves that cross over the top of that, that's the only thing that truly passes over other than fascia on the superior lateral rim, and those are lateral sensory nerves for the lateral hip. Okay? And that's that zone. And finally, so 1, 2, 3, 4, 5. The 5th zone is primary muscles of the pelvis. May I have you on your back, please? And I want you feeling these for yourself. When we do it, we will actually have you do the manual muscle testing when you pass this off or demonstrate it. You do manual muscle testing at the same time as you're palpating this. But we're going to start with the major muscle groups. We're going to have 4 zones in the major muscle groups. One is while you're laying there, go ahead and have a knee bend. Anytime you have a client on their back have a knee bend, that puts the pelvis in pelvic neutral and allows the back to relax, otherwise it's uncomfortable. If you sleep on your back, always bolster with pillows under your knees to put the pelvis in pelvic neutral. Otherwise, the muscles and ligaments of the small of the back are like this all night, trying to support the back, and it never gets true rest. Anterior zone. Don't go by zones 1, 2, 3, 4. Go by their function or their location. Anterior or hip flexors. Medial or adductors. Lateral or abductors, A24, or posterior hip extensors. Let's go with the anterior or hip flexor zone. The hip flexors consist of the iliopsoas muscles, which you cannot palpate. Superficially, we have the sartorius, which originates from the ASIS and passes down. I'm going to have you drop this leg, please. Put this ankle across the knee. There you go. And you lay it. You okay there? If I push on that. Comes down, crosses anterior to the medial lateral axis of the hip, so it's a hip flexor. It crosses lateral to medial on the vertical superior inferior axis, so it's an external rotator. Goes posterior to a medial lateral axis in the knee, and then attaches anterior on the anterior medial proximal aspect of the tibia. I said those fast so you could wolf's law yourself and follow it. Anyway, which makes it a knee flexor. Okay, longest muscle of the body. It is the one that picks up your leg and puts it across the knee like this. Difficult to actually distinguish it, but you know you're on it once you put this position and draw a straight line down in. You find the ASIS and step just off of it. The cord that is most superficial is the proximal attachment of the sartorius. Straighten the leg out, please. Another hip flexor is the rectus femoris of the quadriceps group. We won't get into the vastus medialis, lateralis, or intermedius because they only affect the knee, and we're talking hip. Rectus femoris is a 2-joint muscle, part of the quads for knee extension, and it is also a hip flexor. Hard to palpate because it's deep proximally to the sartorius, and it originates down on the anterior inferior iliac spine between it and the tensor fascia lata. So it's engulfed by muscle, it's hard to palpate, but you can test it and we'll learn how to do that later. Iliopsoas is very deep, we don't find it. Have I hit all of them in the anterior zone? Okay, adductor zone. The one that you truly palpate, I'm going to have you bring your knee into adduct A4 for your leg, please. Push against my hand. As you do that, the adductor longus is very obvious up to the ischial pubic tubercles, but it stands out. If you just grab the medial thigh, it's superior and medial adductor longus. There are 5 muscles that are the adductors. You've got the pectineus, the gracilis, the adductor longus, brevis, and magnus. Of those, Hoppenfield says you only palpate the adductor longus. In my opinion, the lateral most is the gracilis. You don't truly distinguish it, but it is there. You're on it when you're palpating. Medial aspect or adductors. Other things to cover there? Lateral aspect. Please lay on your left hip. Lateral aspect. Gluteus medius and minimus originate from inferior rim aspect of the rim of the ilium. Right here. As soon as you step off laterally from the PSIS over to the iliac tuber or tubercle, you are on the gluteus medius. You cannot palpate the gluteus minimus, but it mirrors the medius. It's just deep. They both originate down on the greater trochanter superior aspect. To make it stand out, please bring your knee up to my hand. Do pure abduction, 8-2-4, and it'll stand out and you can grab it. Okay, to palpate that soft tissue and relax. Okay, lateral or abductor zone. Finally, hip extensor. Over on your belly, please, or prone. Gluteus maximus originates from the PSIS, and here I disagree with Hoppenfield. Posterior, well, let's do what he does. Inferior border, he says from the coccyx. So palpate the tailbone coming on down till it drops off. And then there's the anus if you go too far, and they'll let you know. And then the genitalia. So just as it drops off is the coccyx. Hoppenfield says it goes to the ischial tuberosity. Incorrect, because that's not even crossing the hip joint. That's going from the sacrum to the pelvis and not to the hip joint. It actually goes down to the gluteal line, proximal third, posterior aspect of the femur. So from the coccyx down across like this. So it runs just like this, inferior border. Superior border, PSIS, down to the greater trochanter. And the medial border, lateral border is down the gluteal line of the femur, posterior aspect, proximal third. Medial border is the midline of the sacrum, the spinous process of the sacrum, and along the sacrum. Let me have you bring a straight leg straight back, please, with a straight leg. Lift your knee up off the ground. You'll learn to test it later. Excuse me for my grab, but I've got your permission. It's just parallel fibers like this. Pick the whole leg up off the table. There you go. It's not easy to do, and you can grab it right there. Relax. For the borders here and here. Gluteus maximus, hip external rotator. Did I cover all of those? I should have.
Hamstring on next.
Hamstrings, thank you. Two joint muscles, part of them, not all of them. Biceps femoris has two heads, and then the semitendinosus membranosus. All three of them are two joint muscles. We're not going to deal with the distal attachment, which is a knee flexor, but they do come up in all of them. The long head of the biceps femoris, and then the semitendinosus and membranosus come up and attach right in the ischial tuberosity. So you can palpate it there and then come on down a little bit. You don't truly distinguish them both unless I have you bend your knee, please. And I'm going to resist it. Hold it right there. Don't let me move your leg. And you'll feel different muscles stand out. We'll learn when we come to the knee how to distinguish those, and relax. Questions? Yes, please.
Somewhat
You're good to
related.
go. Thank you. Get comfortable.
How is it when someone's laying in the prone position like that, if you were to say do a hip flexor stretch, that there's sometimes a pain in the lower back, and if you apply pressure at the lower back or kind of at the top of the gluteus maximus, that pain goes away.
It alleviates the pain.
Or maybe that might just be that they have a tight back, and when you press there, it alleviates it when they also have
Like
hip flexors.
Drilling into a pressure point or something. It would just be my opinion. I hear you saying, may I have you lay right here on your belly? This is what I'm hearing you saying. I'll try to demonstrate it. So I'm doing a hip flexor stretch, so I'm doing this, correct?
Right.
And you're saying that you get a pain right up in here.
Right.
By the mechanism, you're doing compression.
Okay.
In like this. But then you're saying by putting pressure there, notice my biomechanics, wide base of support, don't bend at the back, but rather soften the knees. We'll get to that someday. You're saying by putting pressure there, it alleviates that.
Yes.
I would just say that it's my opinion, but it's just like doing a pressure point and getting the muscle to relax. Other than that, I don't know. I've not experienced that putting a pressure there alleviates that problem. Sorry.
That answers the question. Thank you very much.
Others, Mikey.
I was just reading the book where it says to palpate the common organs of the ischium.
I'm sorry, say again.
Talking to the hamstring muscles is saying to have the patient on his side and bring the knees to the chest to palpate the common organs of on the ischium.
Of the hamstrings.
Of the hamstring.
Okay, that is another way for them to be passive. They're talking of doing this, and then it exposes the hams here, but it also exposes them by having an isometric contraction, makes the tendon stand out here.
Okay.
Because it's a hip extension.
Can you do that again?
What they're saying is if you're in this position, the glutes may be hiding the hamstrings.
Wow.
The hamstrings are deep to it. But in this position, you're taking the glutes out of the picture so you can then just palpate the hamstrings. And that's probably very effective. But I can feel them either way.
Okay.
Does that make sense?
They all originate on the ischial tuberosity.
The long head of the biceps femoris, and then the tendinosus and seminosus.
Don't worry
I'm
about
missing
it.
something here.
They're
Seminosis-
taking a picture of you because it's funny that you're on your side. Playing with
We
your
just,
legs.
we just need a banner, we just need a banner for the Facebook page.
For the Facebook page. We're
Yeah.
Always.
Lower head of the biceps femoris, semitendinosus, and membranosus originate on the ischial tuberosity. Short head of the biceps femoris comes off the posterior proximal aspect of the femur.
Would a lot of lower back pain be associated with your hip extensors?
Good question. Hip extensors are all from the PSIS down. There's a lot of muscles involved there. In my experience, you've got quadratus lumborum, a number of things there that could be involved. I would say the hip extensors hurt because of lumbar issues, not so much the back hurts because of hip extensor issues. But they can refer.
Going with that question, what do you do for patients with lower back pain usually?
You make a career of it.
Find out what works.
I had a patient
You make a
who
career of it.
had a-
There's specialists, there's chiropractors who make a career of it. Physical therapists can specialize in just low back pain. Pain clinics specialize in back or low back pain. For me, somebody has back pain, if it's not a permanent herniation or something like that, I'm doing stretching and strengthening for them, or teaching them how to do that. And on another day, we'll take some time and show you my favorite stretches, 3 or 4 of them, that serve the back best. And if some of you work with a lot of patients with back issues, and I could be your student as well, they've written a number of different books, and they conflict and they complement each other. Strain or pinched nerves of the nerve root is the origin typically.
Where does the sciatic nerve fit into all of this? Is it
Sciatic
just
nerve
the
comes
sciatica
off
and
of
stuff?
distal, thoracic, and lumbar nerve roots. A bunch of nerve roots come together to a common nerve, a bundle of axons that travels clear down the leg. You involve any of those nerve roots, it can radiate down and feed any of the muscles from there on down, mostly posterior. And sciatica, we call it for a Godwin's term.
Does that fit into this area of palpation though, or would it go into a different?
It's this area of palpation.
Okay.
We're not getting into neurologic evaluation. That's another semester, but the book does a good job of it. And but we did do the sciatic nerve, so you can test it itself.
Okay.
And if there's pathology along it, if you stretch it or something, somewhere along the length of it, it'll induce the pain. Very incapacitating. Mikey.
A follow-up to that, and then I have a different question, is so the sciatic nerve is a combination of different bundles coming from the spine?
Nerve roots coming together to make a common big bundle, yes.
Okay.
And then they peel off into branches, peripheral branches.
Okay, that's interesting. Also, I just wanted to clarify the exact part in the book that you disagreed with. It's on 154 probably. You talked about gluteus maximus when you were saying that
Okay.
the coccyx.
Yeah,
I
he
was
says
thinking that right there.
gluteus maximus, an imaginary line drawn from the coccyx to the ischial tuberosity, represents the maximus lower border. So that's
Is
going
that
from
part?
here to here, and I'm saying no. Then it doesn't even cross the hip because it's going from the coccyx to the ischial tuberosity. You haven't crossed the acetabulo-femoral joint.
Uh-huh.
It's going from the coccyx clear down to the posterior, is it the linea alba, where the gluteus maximus originates.
But then he says another line drawn from the posterior superior spine to the slightly above the greater trochanter represents.
That's the superior border, that's valid.
That's the other.
Let's look at this here.
I just wanted to make sure on that.
Sorry that you can't do it with the pictures. What he is saying is it runs from here to here, gluteus maximus. No, then it's not even going to move anything because these are a amphiarthrodial joint. There's not much movement there. It actually runs from here, and that's the origin, the red, clear down here to the linea
No, it's not linear.
aspera,
Linea aspera is more distal.
down here. Anyway, it runs from here down into here, and from PSIS down into here.
Okay.
So here to here and here to here.
And that's abdominis maximus.
Correct. Hip external and hip external rotator and hip extensor. Thank you. Others, get some experience, please.